Dr. Kenneth Iyamu, Department of Surgery, UBTH. I like the initiative of the Creative Future Foundation, creating awareness for cancer, especially breast cancer, and what he has done today in this pink October to bring awareness and free screening for as many people that were around today for breast cancer campaign, awareness and education and screening, which was quite insightful because we've been able to get a number of persons, one or two, who have some problem with their breasts that need to be further investigated so that we can make a clear diagnosis if it is breast cancer or not. And I believe also that the awareness has risen high among the participants today so that they can go ahead also to be having their monthly self-breast examination. By so doing, get to understand their physique, and then if there's any changes, be able to make early alertness for further care and further treatment and diagnosis. This foundation is not quite easy because it's non-governmental, and people will wonder, oh, if I put in something, what am I really going to gain? What is there really for me? But the truth is that to a large extent our help to our neighbors, to our society, it's also a help for us, because at the end of the day, if you're able to help somebody who is in need in one way or the other, you have also helped yourself and you brought smiles to the life of many people. Most of these people that may have this condition are not buoyant financially, and some of them are not even able to cater for their expenses for investigations, treatment and all that. So I believe that to an extent, when this foundation is growing, there's need for a trust fund where we can be able to give assistance to persons that may have need in one way or the other. And more so, it's not a one-man show, because it's not what one man can really do. The demands are enormous and the needs are large. So it's important that people can collaborate together, other foundations, other organizations, even other non-governmental organizations, even the government can collaborate and say, oh, want to take this section of the state, want to do an awareness for them and give them free investigations, treatment, mammogram and what have you. So in that way, we are increasing the awareness and we are getting early detection so we can be able to either achieve a cure or be able to prolong the quality of life of the individual. So it's important that people come in, because the truth is, finance is needed to run an organization like this. It's not what we can shy away from. Even if it's non-governmental, we need money as much as possible to do things, to create awareness, to be able to reach out to many people, to be able to render assistance to them when they come. Because it won't be so good that when they come, we now also become helpless and when they arrive. I think it's important that we're also able to help them as much as we can. So I solicit that, added to what has been done today, that more persons should come on board to render assistance in one way or the other, so that we can have larger turnout, larger organizations and larger reach, so that at the end of the day we'll also be able to render better help and assistance to as many people as they are that come. So thank you very much. I encourage the organizers to keep the flag flying and then to keep the work going. Never be discouraged. Everything great starts small. Maybe small today, but tomorrow is great. But even if it's one person you're able to affect today, that one person, it's something very worthwhile. It's worth the sacrifice, it's worth the effort. Even if it's one person that was touched today, I think it's worth it. So never give up, keep striving, keep going, and someday the vision will blossom to much more, even more than you expected, and exceed your expectation. So I believe that we will get there someday. So thank you very much.